Mental health for me, I think, is just to be able to feel happy, to feel whole, to be able to function at my best potential.
I think it really boils down to self-love and self-acceptance.
You cannot have physical health without mental health. The same way that we go get checked in with the dentist, I think we should engage with our mental health at the same level. You don't go to the gym because something is wrong. You go to the gym to maintain or to upkeep, and the same applies with our mental health.
I feel like mental health has become more easier to talk about, like with everyone's families and friends. I feel like now that it's becoming more of like more spoken about issue. I feel like before I didn't really understand it, like, or I never really talked about it. No one really talked about it in my house. But I feel like as time progressed, I feel like the last like 3 years, actually I'm gonna lie, like 2 years, I feel like it's been a bit more easy in my house, especially. Like now we talk a bit about it more, like how we're doing, how we're feeling, and we don't really invalidate each other, especially coming from like, you know, like an immigrant household, and like even my friends, like, you know, we talk about how we feel and that sort of thing.
With my family, it's not something that I feel like I couldn't talk about. I think it's something that I just do not talk about, not because my parents aren't capable of having the conversation, because my mom's a nurse, like she works in healthcare, she sees all kinds of things. So I could probably discuss things with her, my mom would understand. My dad, he has a business, he does his own stuff as well, and he's traveled everywhere in the world, like more countries than most people that I know. So he would understand, but it's more so like, it's almost like I feel like I can't talk about it just because they're my Nigerian parents.
The Africa Center Clinic is so unique. It is the first one in Western Canada that is Black focused. So all of the counselors are from various types of Black backgrounds and countries and all the things that it encompasses. And the reason we created the clinic is because through research, the university, YUG, the Come Up, and Dr. Bacola, along with the activities that we were doing at Africa Center's preventative mental health program, we heard what not just the youth were saying, but the adults were saying, and that they wanted to access mental health resources. However, there were too many barriers that existed. So this clinic acknowledged the barriers that they told us, and we went to remove as many as possible and create a safe space that was culturally relevant. And someone might be like, oh, well, what barriers exist? Something as simple as hours. So the clinic operates on evenings and weekends. Or instead of always needing an interpreter, currently between the therapists that are available, we can offer 12 different languages.
I think it's really important now that there's more mental health in our community in regards to us being Black people, people of color, BIPOC people. So I think that's extremely important. And for myself, even trying to go through the system that we live in to find adequate therapists, to find adequate help for you guys and for myself and for us as a family was always very tricky. So the fact that now we have free access to therapists that look like us, think like us, and have been through some of the things that we've been through just makes mom feel a lot better. It makes me feel at ease to know that even if you guys do see somebody, that you're in good hands because somebody kind of understands where you're coming from, even if it's just what you've been through school or growing up in Edmonton, Alberta. So I think those things are extremely important. How about you guys?
I would agree. I know that therapy and stuff like that is really expensive, and to have it for free is a privilege because a lot of families struggle, and like financially it doesn't always affect the kids, but a lot of the time it does. So knowing that they have someone that they can be comfortable with without having their parents being stressed about the money, it seems like it'd be a really great thing to have.
I agree.
I agree as well. I think it's super important, and I think it's a big step for the community because I feel like for a while mental health was something kind of pushed aside in the Black community, and now as we're moving, I guess it is harder times, but now that we're moving forward, I feel like it's getting a lot more spotlight, which is good because it all starts with mental health. You can't really care for others if you're not caring for yourself well, so having that and having it up free and having people who can relate to you is a big step, and it's super important.
A lot of the challenges that people face is, you think about, oh, I want mental health help, or I want to be able to find a therapist. I want to be able to find resources that would actually help me. But number one, I don't know how. And number two, it seems just like I'm a student, like I have work to do. That's a lot of work to start doing. But you can do that on your walk from class. Like, you're walking from class, you just think, okay, if I was like going to see my therapist right now, like what would that be like? Or if I was going to see a counselor, someone who could just talk to me, like what would that look like? And I think anybody who can think through that situation, 9 times out of 10, you'll leave it, feeling a little bit more motivated to just do a Google search on your phone, like, or to just search, e-mental health services.
A lot of people are scared to put what they bottle up inside out there because they're showing you weakness. But again, you're talking to someone who promises to keep it personal, like to keep it just between you two. I feel like some people just have to find someone that looks like them to get that full trust.
To see a counselor, we made it so easy. We wanted to remove as many barriers as possible. So somebody can either call or they can go online to africacenter.ca/counseling and book their appointment directly, where they can actually see the bio and picture of the therapist that is available before they book, and also book a consultation to make sure that therapist is right for them.
The best and most effective way to help a community is to offer them services based in their community, with a cultural understanding, with cultural sensitivity. Too often, I think we subscribe to these very big, generic ways of offering services. We don't think about the individual impact. We don't think about things like access, and we don't think about things like cultural sensitivity. So this clinic, I think, is a fantastic model, one that I've seen successful in other racialized communities, and one I'd like to see a lot more of.